The really big question. If you could change one policy or law that has impacts on people with physical or developmental disabilities, what would that law be?
That would be to increase the resource limit. It would be a big push, both statewide and federally, but the resource limit basically forces people who are receiving public benefits into poverty. And that's such an unfair and unjust way. They can't save money for the future, they can't plan, they can't save money to buy a home.
Welcome back to the Flathead Industries podcast. It's called Podcast with a Purpose. I have Patrick Madison back, and welcome.
Thank you. Thanks, Alex.
We are talking about some big stuff today. So we thought last podcast answered a lot of questions for people. And so we had some really good feedback that people wanted to understand the deeper stuff better. And so today we want to talk about legislation, which is kind of a big deal in the state of Montana, across the country, and how that legislation can impact people with disabilities and the services that they receive.
It's a huge impact, and the timing's perfect since we just closed session.
Mhm.
So I know we'll dive into more of the details of session in the next podcast, and we'll just do a quick overview of how important legislation work for Flathead Industries and how we impact people with disabilities and how important that is.
I think the biggest thing that I learned coming into this business in the nonprofit sector is how much legislation actually does impact us on a daily basis. I had no idea. And I think a lot of people probably have no idea actually the impact that it has. And the fact that you were just at legislation on and off for how long?
3 months.
3 months. So and it's not continuous, right? You come back and forth to Helena, but it's a lot. It's a big weight to carry, and Patrick is heavily involved in it and is extremely active in lobbying and going and speaking and making these huge speeches in front of people, which sounds terrifying to me, but
it's a lot of fun. I've gotten better over the years, so it's not as uncomfortable, but now I actually really enjoy it, and building relationships with legislators and helping them understand the huge impact, like you were talking about. When you just strip it down to Flathead Industries, 85% of our budget is controlled by the legislature. So pretty huge deal for us to maintain operations.
And I know that last year you were actually on the news talking about, when was that? October last year? You were on a news just last second in your hotel room. They just called you and they said they needed an interview.
Yeah,
So
I had the pleasure of being appointed by Governor Gianforte to the BISFIG Commission, which is Behavioral Health Systems for Future Generations. And so obviously that got a lot of media attention. There was $300 million being allocated out in different ways, and we were charged with basically fixing the system for behavioral health and the developmental disability program. So yeah, jumped on lots of calls and got interviews really quick in hotels wherever I was. I think I was in Chicago at that time.
You were in a random city. I remember you texted and were like, I did a thing. I was like, send it to me. We'll do some marketing around it. Let's kick things off with a question section with a really big question. If you could change one policy or law that has impacts on people with physical or developmental disabilities, what would that law be?
That would be to increase the resource limit. It would be a big push, both statewide and federally, but the resource limit basically forces people who are receiving public benefits into poverty. And that's such an unfair and unjust way. They can't save money for the future, they can't plan, they can't save money to buy a home. So it's outdated and harmful, and raising those limits would allow individuals to save money and build for their future.
Okay. What does that limit impact? What does that mean? So the limit impacts how much they get in resources from the government? How does that, I don't know.
Yeah, so to qualify for Medicaid, which people with developmental disabilities must be on Medicaid to receive our services from our direct care staff. And so in order to do that, there's different Social Security rules for everybody. So it's really complicated.
Size of family.
Yeah.
Okay.
Break it down. They can't have more than $2,000 in resource.
Okay. A month.
No.
Total.
At all.
Oh
Ever.
my gosh.
That's all they can have. And so once they go over that $2,000 threshold, then their Medicaid benefits are in jeopardy.
Oh my
And that means their health care. That means their services they receive every day just to survive are all in jeopardy. And so that's why that would be such a big push to move that needle to, 8,000, 10,000, something that doesn't force people into poverty.
Yeah. that's like a mortgage payment. That's crazy
Yeah,
low.
to
That's
any
not
one of
even,
us,
yeah.
that's unbelievable.
That's I can't even fathom. Okay, so that does explain stuff. So with this, I will just preface, being the marketing person here at Flathead Industries, I am somewhat removed from the more detailed nitty-gritty of the legislation or the Medicaid reimbursements or like how that stuff functions. So I will have some like off the cuff organic questions today too, just learning things directly from Patrick because he knows it all.
That makes it fun.
Really, it's really organic. Okay, so was there any one specific moment, you've been doing this quite some time now, that really opened your eyes to this importance and the advocacy that you hold in the legislative sessions?
Absolutely. It was 2017 budget cuts. It
Mm,
was absolutely devastating. The revenues were projected differently from different budget policymakers, governor, Senate leadership. And basically, there was they came back into special session and had to cut a bunch of money out of the budget. And they focused that on behavioral health and
mhm,
developmental disabilities and um, er- uh, di- early intervention services. And so case management services were decimated at that time for people with mental health. And so that really struck home. And they did it in like a week.
mm,
So it
okay.
was fast,
Yeah.
furious, and the decisions were already made. And so that's the time in my that it really sunk in how important it
Hmm.
is to not only be active in the legislative process, but to have relationships with high level, high powered individuals that can make these decisions very
Hmm.
quickly, and that you have that relationship and that trust with them when things happen. They will listen of, if you do this, this is what's going to happen, and they'll actually understand that and hear the message and
Right.
focus on maybe balancing the budget more equitably.
Right. That makes sense. And that sort of big cut is what our thrift stores became so much more important at that point,
Exactly.
right?
Yes.
Because that's how we stayed afloat. There were other places that had to close their doors.
Yes, there were providers that closed their doors. There was, especially in the mental health realm.
Hmm.
Case management across the state basically disappeared for people who really need somebody to help guide them through a complex
Hmm.
system. But it did hit home that that was why our thrift stores are so important, and we
Hmm.
needed to really dial in that operations, not just because of that cut, but it really sunk home to us that we have to do our part. We can't be 100% Medicaid dependent
Right.
because we have no control over some of those cuts or
Hmm.
what could be in the future even.
Yeah,
So it's a reality that we have to operate our businesses like businesses and contribute to the bottom line.
that makes sense. So I think that helps a lot of people to understand the reason for the thrift stores. Like a lot of people don't necessarily understand the connection, and we did touch on that a lot in our last podcast, but just helping people to understand that the thrift stores just help to support what's already there with Medicaid, but as said, like 80% is
85% is Medicaid.
85%. And so it's, if Medicaid got cut tomorrow, there would be a huge impact, but we could stay afloat because of our thrift stores. And so
Exactly.
when you shop or donate, it actually is super directly impacting people, not just like vaguely, oh, they have thrift stores. Like there's a direct correlation. So I think that
Absolutely.
helps
It's
to
how we pay the
understand.
wages we pay, and it makes
Yeah.
us a sustainable operation.
And I mean, yeah, we do actually pay really good wages. So people who work at our stores actually also have a livable wage in Kalispell
Yeah.
and Sioux Missoula. And it's just one of those things where it's kind of hard when you're coming out of college or high school and you want a good job and you can't really find one. So it's nice to have that ability to give a livable wage with really quick raises too. There's a
Yeah.
system in place for that. So,
Not only the people working in the stores, but people providing care. They
mhm,
come in at 18
all
bucks
the
an
group
hour,
homes. Yeah.
1950 in 6 months, and
Hmm.
21 at a year. So, and it's really helped us,
That's a good amount.
and it's really helped with our retention.
Yeah.
Before we implemented that, we saw quick turnovers within the first 3 months. And so having that staggered wage increase really helps people stick around a little bit
And good
longer,
benefits too.
which
Yeah.
provides better services
Yeah.
to individuals because they know who they're caring for, they know how to
The
care for them.
continuity.
Yeah,
The
exactly.
continuity
Continuity
helps.
of
Yeah.
care.
Okay. Okay, so next one. How do we make sure that people with disabilities aren't just being spoken for, but are actually helping to shape the laws? And I think that's a really good one. Like, where are they sitting in this conversation?
Absolutely, it's paramount. I mean, this is what's impacting them every day. So it starts with
Mhm.
collaboration. We need partnerships between self-advocates, service providers, individuals with disabilities, families, and
Hmm.
lawmakers. But the most important piece is listening,
Yeah.
and hearing what people need. That means truly hearing what individuals with disabilities want and need in order to live their most independent lives.
Right. That makes sense. So for me, I think something I just want to touch on too is we have accepted some questions from public. Sometimes we get questions just through conversations at public, the Rotary meeting or
Hmm.
an event,
Hmm.
but we've also kind of opened it up on social media for people to allow us to ask those questions. So next one, when you're working with those lawmakers, what actually is moving that needle? What's making the real change happen? Is there something specific?
Absolutely. It's 100% about relationships.
Mhm.
I work very hard getting to know new legislators, continuing relationships with legislators that have been around a while. So when you know legislators, they trust you. They're
Mhm.
more open to listening and taking action, and showing up consistently, sharing stories, offering solutions grounded in real world experience. That's what builds momentum over time.
That makes sense. Yeah, I mean that's how marketing works too. That's how everything I do works is relationships. So that makes a lot of
Yeah.
sense actually. Okay, so this is a funny one because I actually helped contribute to this question too. Policies look really good on paper. So like a lot of people maybe don't even understand how the government works, but policies can be quite large and big and sound great. But how does that actually make an impact when it goes to the ground, to the people in a real world situation? And is there a disconnect sometimes?
Absolutely. It's gotten better over time through forging these relationships that I'm
Mhm.
talking about, but too often laws are written without input from the people who are actually providing services
Mhm.
or the people receiving services. The frontline voices, direct support professionals, if we bring them into the conversation, we'd see more practical, effective
Mhm.
solutions. They're the ones that are doing the day-to-day reality and what actually works on the ground level.
And like you have weekly meetings with our client service directors who are directly talking to everybody, but you're also super involved in everything. Like you know everybody by name in
I
the
try.
whole you do. You know everybody by name. And so it's like having those conversations in like a here and there conversation actually impacts how you move forward when it comes to legislation based on those conversations.
Yeah, 100%.
Okay.
I made a promise to myself a long time ago that I would never forget what it's like to provide direct care.
Mm-hmm.
I started my career providing direct services. I've provided case management services. I've built smaller programs. And so every step I took, I always promised myself that I'd never forget how important that work is,
Mm-hmm.
how vital it is, and sometimes how underappreciated they are.
Yeah,
And so that's also always in the back of my mind when I'm trying to create change.
that makes sense. Okay, if you had 5 minutes with a senator or representative, what would you say to like an elevator pitch to help them truly understand what's at stake, to truly understand what you're fighting for every day that you're there?
That's a tough one. One, I would want more than 5 minutes, but if I only had them, I'd tell them services for people with disabilities aren't optional. They're not a luxury. They're essential for their
Mhm.
survival. These programs make it possible for people to live, to participate in their communities, to have dignity.
Mhm.
Cutting them or underfunding them isn't just harmful, it's dangerous.
Yeah, that makes a lot of sense. That's a quick one.
Yeah,
You
and
just
you do
straight
get
to the
those
point.
30-second
The
passes
elevator.
with
Yeah.
legislators because
Hmm.
they are on to their next hearing,
That makes
and
sense.
you have that amount of time to make an
And
impression
if
on
you
them.
had more time, maybe you'd make a peanut butter and jelly sandwich with them,
Yeah,
right?
totally.
Okay. So, just for clarity, like think for a second if you were to make a peanut butter, and I actually had my children do this because they didn't really understand what I was saying when I tried to explain this to them. But if you were to write down the instructions to write a peanut butter to make a peanut butter and jelly sandwich, like everything from grabbing the bread, taking the turny thing off, opening the jar, everything that you do, like do that challenge with yourself one day and just try to understand what it's like to really break things down to the basics. And that's it helps really illustrate, I think, what the care looks like.
Absolutely.
What kind of long-term changes could we see if more people got involved in that advocacy at either a state level or a national level? And I guess also like normal people versus like maybe CEOs versus
Absolutely.
legislative people.
Again, it's a collaboration. We've seen real progress when we come together around a unified message. In recent sessions, we focused our efforts through just a few well-prepared advocates, and it worked.
Mm-hmm.
We secured provider rate increases and started pushing for continuous eligibility for people receiving waiver services. These are all critical components of what we do. Starting that work early in the interim could lead to even more lasting change, like tying funding to cost of living increases.
Okay.
That would be a goal. So it does take collaboration and just organized, because a lot of the times when we're speaking, it's you have 3 minutes in front of a committee.
Mm-hmm.
That can be stressful for somebody with a disability who might not have the ability to articulate or the ability to
Mm-hmm.
read something. So really finding those individuals who are interested in that advocacy, who want to get up in front of a stressful hearing
Mm-hmm.
and give that message. So we do work a lot with self-advocates on that, so that they are hearing directly from the people that are receiving services. And we connect with family members who can tell their story of their lived experience, and
Right.
that connects with individuals out there, because legislators want to represent their constituents and they want to do the right thing.
Mm-hmm.
If we paint the picture and tell the stories, then it's a little easier when that comes up for a vote to say yes.
Right, that makes sense. I do have a question just that came off the top of my head. You said earlier the cuts happen in like a week. How quickly, if something gets signed, so we have stuff currently waiting to be signed,
Correct.
right? If that stuff gets signed, how quickly does that get implemented?
So, as far as some funding increases, that would go into effect July 1.
Okay,
It would take a little while, so we wouldn't probably be able to bill for services until maybe September, so that we were billing at the
right.
accurate rate, because it does take time to go in and for the
Process things.
departments to
Yeah.
start adding all that stuff in. There's some bigger stuff that's going to be probably the next 2 years. I will
Mm-hmm.
be working directly with the department on implementing. That's acuity-based rates, a new validated assessment tool,
Mm-hmm.
START resource center, and provider capacity building, and reopening evaluation and diagnostic clinics. So huge session for us this
Mm-hmm.
year. So we're really excited.
So yeah, so some stuff is quick. Some stuff that's bigger takes a little bit longer.
Correct.
And how often is it that you go to legislation? It's every
Every two
two
years.
years, right?
Yeah.
Okay. Just wanted to make sure I'm right on that.
But in that time, that's what's called the interim time. So there's committees that meet
There's
throughout.
lots of committees, right?
So it's not as heavy, but there's stuff that
There's still
I'll
stuff
go in and I'll
happening.
want to listen to, like the interim budget committee, because they're
Okay.
starting to try and set things for the next session.
Then you know what to bring to session.
Exactly.
Okay, that makes sense to me. Okay. Here's a really good one. What role do allies play in this movement? So family members, caregivers, our staff who are caregivers,
Yeah.
professionals, like you said, case management, and how do they support without just taking over? How is that seen in the reality of life?
Yeah, absolutely. I think that could be same for like me speaking. Like the
Right.
best thing allies can do is help amplify the voices of people with lived experiences. That
Hmm.
means supporting individuals in telling their own stories, and when appropriate, sharing family stories in a way that highlights real life impact. And legislators need to hear those human experiences
Okay.
to truly understand what their decisions are,
Yeah, to
and who they're
understand what they're
impacting,
doing.
and what
Okay.
it means for the individuals on the ground.
That makes sense to me. I think the biggest thing that I've always found interesting is like working in marketing in a nonprofit can be kind of one of those funny things where like you're advertising for something that's not supposed to be making a profit. And so some
Right.
people are like, why do you need marketing? So for us, our marketing is specifically just to help people understand who we are and what we do.
Hmm.
Whether it's the thrift stores and what we do in the thrift stores and how that correlates back to our actual direct services, or you going to legislation, or sitting down with a few of our consumers and hearing their stories, and if they're okay with it being recorded and sharing that publicly so
Right.
that average people can hear direct stories from lived experiences. So,
That's essential,
yeah.
and many of the individuals that we serve with developmental disabilities don't want to, or maybe aren't quite able to
Hmm.
travel to Helena.
It's a big
It's
trip.
a big trip,
Yeah.
sit for hours
Hmm.
before you get an opportunity to speak, and then in a very intimidating environment. So
Yeah.
when we can tell those stories using your guys' skills through marketing, that's just as effective, because we can send that out to their emails,
Yeah.
and please watch this, and they can, on their own time, hit play and listen to somebody with lived experiences tell
Totally.
their stories. And I would just like to add too, we talked about this a little bit, of braiding resources in the last
Hmm.
podcast. our marketing team is part of that braiding
True.
of resources.
Yeah.
We're fundraising,
Hmm.
hosting galas, working all the time to get donations, and that's also how we continue to be sustainable.
Yeah. And part of those donations, not just like kitchens we talked about last time, we do the kitchens, but we also have the Bridge the Gap scholarship for
Yes.
that, when there's a gap in funding. And so that resource that we're raising money for, it goes to so many things and so many things are benefited by it. And so it's really rewarding for me and our team and the marketing team to really see that come to fruition and go to the store and see all the consumers and say hi to them and get hugs and like, how are you doing and what have you been up to? It's really rewarding. So I think that's all we have today. I would also like to extend an invitation to send in more questions. Like, we love getting questions from people. We love the commentary because it helps us. We're really close to the picture when you're away from the big picture and you can kind of see. It helps you see questions that maybe you didn't think of before. So send them over, marketing@flatheadindustries.org. We'll add them into the next podcast. And the next one we're planning to do is a more in-depth version of what exact legislation went through, the stuff that just happened is about to be signed. What does it mean on a day-to-day basis or a month basis for us, for
Yeah.
our consumers, for our staff, for every layer of Flathead industry? So I think that's all we have today. Do you have anything else you want to close with?
I don't, but thank you so much.
It was super fun.
Yeah.
So thank you for watching, and we'll catch up with you guys on the next
See you
one.
next time.